Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about Boswellia serrata. That is the scientific name for the ancient herb known as frankincense. Yeah, you've heard that word before, frankincense. Boswellia is outstanding for pain, kind of like noni is, but it works by a different mechanism. We want to talk about Boswellia today. You now have another option to help control that chronic pain or even acute pain. Outstanding substance, this Boswellia. It has endured over 3,000 years of use, and that's a pretty good track record in my book. That's our topic for today, Boswellia. But first, let's go to the news. Let's see what's happening in the health world. Eating organically raised foods provides substantial health and safety benefits. New research from Washington State University, a review of 343 previous studies, finds how we raise our foods affects their quality and nutrient content. The study found conventionally raised foods are fertilized with high levels of synthetic sources of nitrogen. This stimulates them to produce more sugar and starch, but fewer nutrients like antioxidants and essential vitamins. They also found conventionally raised foods are 3 to 4 times more likely to be contaminated with pesticides or foreign chemicals and heavy metals. Organically raised produce, on the other hand, well, they're fertilized with organic fertilizers that stimulate plants to make more vitamins and nutrients, such as polyphenol antioxidants that provide tremendous health benefits. Plus, their pesticide content is 1/10 to 1/100 that of conventional foods. A few months ago, a similar study was released that found organically raised foods provided only marginally better nutrition. However, the major media outlets interpreted that study to mean, well, it's a waste of time and money to eat organic. This new study is being heralded as being far more inclusive and reliable. There is no doubt in my mind that eating organic foods is in your best interest. And isn't this fascinating? When plants are fed synthetic fertilizers, they are stimulated to produce more sugars and starches. Well, that's something we get far too much of as it is. But when we use natural and balanced fertilizers, the plants make less sugar and more vital nutrients, such as vitamins and powerful polyphenolic antioxidants. These are compounds we could all use a little more of. Also, this study got it right when it comes to pesticides and other toxic contaminants. Conventionally raised crops all have pesticide residue, and they are 3 to 4 times more likely to be grossly contaminated with the lingering toxins. And this is my major concern with conventionally raised produce. Another study from the same university that produced this study, Washington State U, found from animal studies that some types of pesticides used from food production creates disease in 3 successive generations, even if the second and third generation has no direct exposure to the pesticide. The pesticide studied was methoxychloroquine, the pesticide that primarily replaced DDT, but was also banned in the U.S. just a few years ago. Its effect lingers still, and other countries continue to use it, even some who import produce into the U.S. Smoking dramatically increases the risk of death. Researchers from Copenhagen University have become the first to use genetic techniques to better understand smoking's health risk. The study followed 55,000 subjects for 10 years, 30,000 of which were smokers. They found smokers are 75% more likely to die in any given year than those who have never smoked. They also found those who have received a newly identified smoking gene from both parents smoke 20% more on average and have a more difficult time quitting. The study was published in the International Journal of Epidemiology. Related research from Concordia University reported in Nicotine and Tobacco Research finds depressed smokers must step out to smoke twice as often as non-depressed smokers. The study found although 20% of Americans smoke, among depressed Americans, 40% smoke. They also found taking regular walks greatly improves a smoker's chance of quitting. You know, I think we all intuitively know smoking is harmful to our health, and this notion has been backed with stacks of research over the past 50 years, and it confirms smoking causes disease and early death. But we have never quantified exactly how dangerous it is in terms of death risk until this study. Smoking increases your risk of death by 75%. This study used new genetic identification techniques to help clarify who is most susceptible to tobacco dependency. They found those with the smoking gene smoke 20% more on average, and they have a more difficult time quitting. Now, on a positive note, they also found taking regular exercise in the form of walks greatly improves one's chance of quitting. Another recent study from Copenhagen University finds of all the risk factors for stroke, having hypertension while also smoking increased the risk of stroke the most. Taking regular walks would serve a dual purpose here, as exercise aids in smoking cessation as well as blood pressure reduction. Well, today on Your Health, we'll discuss Boswellia serrata, the ancient herb known as frankincense. If you're suffering from joint pain, today's program is for you. Stay tuned.
May Savings Time is here again with our annual Cancer-Free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Do you suffer from cramps, gas, bloating, or other digestive troubles? How about fatigue, depression, and headaches? All these symptoms could be caused by a condition called lactose intolerance. Your body doesn't digest lactose, the sugar found in milk and other dairy products. As a result, you can suffer from a wide variety of symptoms. If you often experience digestive problems, fatigue, depression, or headaches following meals, try avoiding dairy for a week or two and see if your symptoms lessen or go away. All of the nutrients found in dairy, including calcium, are present in sufficient amounts in other foods. So if you find that you are lactose intolerant, you can safely avoid dairy and still enjoy complete nutrition. For Your Health at a Glance, I'm Dr. Richard Becker. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today.
Welcome back, everyone. It is such a blessing to be with you, and I hope many blessings are coming your way today. Well, we will be taking calls today, so pick up that phone, dial the number. We want to talk to you today. We have an interesting nutrient spotlight to bring you today. This show is going to be really fun. We're going to learn something new. We're going to be talking about an ancient herb called Boswellia. Finally, something in nature that's good for pain and so much more. Richard, this is one of those really fun herbs that has biblical history, which I love to talk about that as well.
It is Boswellia serrata, and we'll refer to it as Boswellia, but it goes by other names, also known as dupe, salai, also shul aki is another name used for it, Indian olibanum, and it is also known as the biblical frankincense. That's right, the same frankincense you've read about in the Bible. Used by the ancient Greeks, ancient Romans, Egyptians, and of course the children of Israel. It is mentioned in the Bible in Leviticus and Exodus, where it is used as offerings and for ceremonial purposes. And then in the book of Matthew as gifts of gold and frankincense and myrrh given by the wise men to the baby Jesus. This has special meaning to me. Gifts to the Christ child must be of great significance. It must be something of substance, gold, of course. We know the value of gold. That gives us an idea of the potential for frankincense, or boswellia, as we'll call it today. It's a beautiful tree. As you see pictures of the Boswellia serrata tree, and the resin that produced by it has beautiful pastel colors. It really is quite fetching to see. The medicinal resin is taken from the Boswellia serrata tree. Lines are cut into the tree bark. During the spring season, the resin is collected in bamboo baskets until fall. There are about 25 different species of Boswellia trees. All have similar resins, but the Boswellia serrata tree is the most prized and the most studied and probably the most valuable of all of them. These trees are indigenous to North Africa, the Middle East, and arid India, but due to the great interest and increased use of Boswellia, the Boswellia trees are being planted all around the world where the environment is such where they can grow well. I can imagine many places in the arid southwest of the United States where they would grow well too. Okay? What makes Boswellia special? What are the chemical entities in this resin that makes it have medicinal properties? Well, it's all about terpenes. Monoterpenes, diterpenes, triterpenes, tetracyclic terpenes, and pentacyclic triterpenes. Now, for those of you who enjoy chemistry, looking at those molecules will tell you a lot. The pentacyclic triterpenic acids are what we call boswellic acids. Okay, boswellic acids. And these pentacyclic triterpenic acid, the boswellic acids, are what we use to standardize Boswellia serrata. So a product with 60-65% boswellic acid is considered a high-quality product. When you look at this molecule, the boswellic acid, you'll see it resembles cholesterol a little bit, but it also resembles cortisone. It is not a steroid. It does not qualify as a steroid, but it has some of the actions of a steroid in the fact that it calms inflammation. Don't be concerned. You're not taking prednisone or cortisone. It's not a steroid, but the body receives it slightly that way. And so it has some of these actions to calm inflammation that we want to take advantage of. And since it is essentially side effect free, you're free to use it in relatively large amounts, okay? This is one of the most ancient herbs in India, used in Ayurvedic medicine. It has been used in India since at least 700 BC and at least 1500 BC or further back in the Holy Land in the Middle East. Uses of Boswellia, putative use, by reputation, cultural use, arthritis, joint and muscle pain, diarrhea, dysentery, skin infections, boils, internal infections, fever, blood diseases, cardiovascular disease, mouth sores, asthma, and bronchitis. That's the cultural use. That's where we have thousands of years of recorded use. Modern scientific investigation reveals Boswellia calms inflammation by at least 5 chemical pathways that lead to, if you don't inhibit it, leads to fever, swelling, pain, all the noxious things we associate with discomfort. Boswellia inhibits those phenomena by at least 5 different pathways. And I'm going to tell you what they are. It inhibits the production of prostaglandins, 5-lipoxygenase, 5-hydroxy-eicosanoic tetranoic acid, and leukotriene B4. Now these are all chemicals that occur in an inflammatory response in we humans that end in bronchoconstriction. The air tubes tighten when this happens. This is asthma, basically. Accelerates and causes inflammation. Not only does it make the tissues inflamed, but it accelerates it. It amplifies it further. It generates free radicals, which causes more damage. It causes inappropriate blood clotting and platelet adhesion. This can lead to blood clotting, and Boswellia inhibits that, but not to the point where you may bleed. See, it's not warfarin, it's not Coumadin, it's not heparin or anything like that. but it prevents the inappropriate blood clotting that can lead to heart attack, stroke, and emboli, this type of thing. That's a good thing, okay? It also inhibits white blood cells who come into the area while they're releasing more inflammatory products. Now, you want white blood cells to come in and to initiate healing and fight infection, but you don't want the broken leg or the strain or the sprain or the disc disease to keep on the auto-inflammatory pathway that we can get. Once it starts, it doesn't want to stop, and that's why millions of Americans take ibuprofen, is to stop that excessive inflammation. But for many of us, we can't take these non-steroidal anti-inflammatory drugs because they cause us so many side effects. Or we have a liver problem, or a kidney problem, or we have an ulcer. We can't take these medicines. You can take Boswellia with all those because it does not have those side effects, okay? So we know the mechanism, the basic mechanism. Non-steroidals do these basic things. The ibuprofens, the aspirins, they do basically the same thing as Boswellia does, but they do it in a very extreme manner. It overdoes it, okay? And they also inhibit the production of glycosaminoglycan. When you take, Cindy, you've told our viewers about this many times, if you take an anti-inflammatory day after day after day, your bones are going to waste away. Your joints get weak. This is the degradation of this glycosaminoglycan, part of our integument, which holds us together. Anti-inflammatories like ibuprofen degrade those connective tissues over time. I'm not talking about the occasional dose for a headache. No. You're in chronic pain. You've been taking 8 to 12 ibuprofen every day for 15 years. Your bones are weaker now because of it. Well, Boswellia does not do that. They've been able to prove this in well-controlled studies. It does not promote the degradation of these connective tissues, and it does not affect the 12 lipooxygenase or cyclooxygenase activities or the peroxidation of arachidonic acid. These are all things doctors, nurses, scientists understand. This is basically what happens when you take anti-inflammatories to the point of side effects. Boswellia gives you the pain relief, the reduction in swelling without the side effect, and that is really quite amazing. As we go through the studies on Boswellia, there's quite a bit in vitro test tube studies. Boswellia inhibits human leukocyte elastase enzyme. Now, what in the world is this? You know, in emphysema, let's say it starts with an infection in your lung one time, and the white blood cells initiate all this inflammation, and they release an enzyme called leukocyte elastase enzyme. What this stuff does is it breaks down lung tissue. It's infected, it's necrotic perhaps, it's trying to get rid of it. Well, you just initiated the whole process called emphysema. Emphysema, you know, what happens basically in emphysema, it's like a bathtub full of bubble bath bubbles. This is a normal lung. But as you sit in that bubble bath, eventually the little tiny bubbles become big bubbles. That's exactly what happens in the alveoli of the lung. The little bubbles become big bubbles because of degradation of the lung tissue. The human elastase enzyme does this. It generates emphysema. It's triggered by inflammation, smoking, infection, bronchiectasis, and Boswellia inhibits that process. So it helps to preserve lung tissue in that setting. Isn't that amazing that they've been able to figure that out? Well, advance on to animal studies. Boswellia has major anti-inflammatory actions with little or no side effects. In animal studies, we can look at tissues and we can prove the effect. That's very hard to do in human studies. On into human studies, they've been able to confirm Boswellia's role as an anti-inflammatory action. Okay? Scientifically confirmed actions of Boswellia include anti-inflammatory, anti-arthritic, antibacterial, antifungal. It can be used as a topical pain relief agent, internal pain relief, useful for arthritis and joint pain, gout, spine pain, fibromyalgia, this is all from the scientific literature, trauma, post-surgery recovery, inflammatory bowel disease, useful in asthma and COPD, emphysema, as we just said, and a variety of infectious diseases. Now let's go to our break. But when we return, let's go to the scientific literature and see exactly what conditions Boswellia will help you with. We'll be right back for that.
May Savings Time is here again with our annual Cancer-Free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bionovations.net or call 888-442-1828 and ask about the auto ship program for additional savings. We're back, everyone, talking about Boswellia. Isn't this interesting? I find it just amazing. And I'm glad to know that nature holds an answer for pain. We need more of those and less of the medications. You know, Richard, there's not that much. I mean, we've talked about how Noni is fabulous for pain, but aside from Noni, I can't think of another one that doesn't have side effects like this.
Yeah, it's really notable how the application for Boswellia and how diverse and how many people could take advantage of this. You know, I found several systematic reviews of all the literature on Boswellia. A couple of them said, we think Boswellia holds the most promise for pain relief of all the natural agents. You know, when scientists make those kinds of statements, it should get our attention because, folks, there's a lot of suffering going on out there, and we're treating our pains inappropriately. You know, there's something I want you to be aware of. When you take a narcotic for pain, in most people, it creates an inflammatory reaction. Yeah, go figure. Sure, the narcotic gives you some pain relief, but as that narcotic wears off, you end up with more inflammation than when you started. It's part of what leads to the dependency of narcotics. So we want agents that calm the inflammation without the hook, without the problems. Okay, and Boswellia is one of those. Osteoarthritis. We have over 30 different trials involving over 3,000 patients finding Boswellia reduces pain and swelling of osteoarthritis of the knee. It improves joint motion and walking distance. It decreases the frequency of flare-ups along with improvements of global assessment of testing of knee osteoarthritis. 30 different trials have found this conclusion. Now, if you combine Boswellia, perhaps with glucosamine, chondroitin, MSM, a little noni, a little fish oil, a little multiple vitamin, a little vitamin D, you're on a state-of-the-art natural approach to managing your pain. whether curcumin would work good in that too, whether it's fibromyalgia, osteoarthritis, maybe you've had a whiplash injury, maybe you have a spinal disc disease, spinal stenosis, whatever your pain is, most any types of pain, you're going to get some improvement with that. They also find in these some 30-odd trials in osteoarthritis and boswellia, significant relief has been provided as little as 5 to 7 days. Now, you may be saying, well, I take my Advil and within an hour or two, my headache's better. That's true, but the full anti-inflammatory effect of aspirin, ibuprofen, naproxen, all these anti-inflammatories, really it's 7, 8, 10, 14 days before the full anti-inflammatory effect occurs. And there are many people in day 14, their stomach is so sore and painful, they're developing an ulcer. They can't continue. When they finally get to the point where they're getting relief, they have a new pain because of it. See, this is the problem with the medicines. So, very little to no side effects. And what is reported the most often, and the only thing I was able to find on boswellia side effects, was intestinal upset. But most people do not have to stop taking it. Most people adjust to it. The problem goes away with time or with a slight decrease in dose. No one has died from boswellia. I looked for toxic interactions, overdose, lethal dose boswellia, toxicology on boswellia. I'm not finding any of these problems. Okay? This spice has been around for thousands of years, and apparently no one has died from it. Can we say that about any medication? No, we really can't. Okay? Boswellia provides pain relief equal to or better than Celebrex or glucosamine, and we know the mechanism of action. We know how this works. Combining with curcumin improves outcomes in arthritis, making it work better than Celebrex. Boswellia and curcumin. Well, I found a study that combined the two, and it worked better than Celebrex for relieving pain. Isn't that amazing? Now, what about rheumatoid arthritis? A very destructive joint disease. I found 2 human trials, multiple animal studies showing that improvements in pain, swelling, and joint function, along with reduced erythrocyte sedimentation rate. This is a test to see the general amount of inflammation in the body. Okay? And it reduces the use of medications in rheumatoid with no significant side effects. One of these trials involved 260 patients with rheumatoid. That's a pretty good study. That's got some power to it. So rheumatoid arthritis, boswellia helps, minimal side effects, reduction of pain, reduction of inflammation, reduction of medication use. Those are all win-win-wins. Next, inflammatory bowel disease, such as Crohn's disease, ulcerative colitis. I found 8 double-blind placebo-controlled trials involving ulcerative colitis or Crohn's disease. They showed significant improvements in pain, clinical remissions of inflammation, bowel movement and frequency improvement equal or superior to mesalazine, which is a salicylic acid that calms the inflammation of inflammatory bowel disease. But again, it is an aspirin-like product, and many people can't take that. So boswellia equals mesalazine for the treatment of inflammatory bowel disease, or better, without the side effects. Outstanding. Miscellaneous conditions, a variety of things boswellia can help. Here's one I found fascinating. You know, when a person develops metastatic brain tumors or primary brain tumors, the brain swells. So much so that the symptoms can lead to early demise, extreme pain and suffering, and compromise with the ability to treat this terrible disease. Now, the standard of care in America and in Europe and most of the world is to treat with a steroid and then radiate the brain and try to shrink that tumor so the person can have some symptom relief and some calm and peace. It's not necessarily thought of as a cure, but it helps to reduce the swelling so perhaps the neurosurgeon can remove the tumor. Well, here we go again. Not everyone can take steroids for this type of problem. And so what they did was they gave high-dose boswellia in 44 patients receiving radiation therapy for brain tumors, and greater than 75% reduction in swelling in 60%. So 2 out of 3 of the patients had 75% dramatic relief of swelling just from Boswellia. Now, they went to higher doses, 4,200 milligrams a day. That would be like 18, 17 tablets of what we will offer you. So that's a higher dose, but I put it in there not because so many of you have brain tumors, but it's to help you to realize there is no set dose with Boswellia. It's been studied up to very large amounts and deemed safe and very effective. If it can reduce cerebral edema, it can help with your swollen knees. Isn't that a wonderful thing to have? We have not had this in the past. Now, I've not seen a study on this, but let's combine, now we're making smart sense now, combine Boswellia with a little noni juice, a little curcumin, you know, a little glucosamine, if you, chondroitin MSM, if you have the osteoarthritis. And then you can get up and start moving again, and study after study shown when you move, the pain is reduced even more. Add your multiple vitamin for all the other things you need, your fish oil for cardioprotection. You're taking advantage of the state of art in nutritional therapy, folks. Now, this isn't going to help like that, but give it a week, give it 2 weeks. Start a new pattern in your life. You're going to get some relief in pain. Let's go to our break, but we have more on asthma, diabetes, heart disease, and more with Boswellia. Good stuff when we return.
May savings time is here again with our annual Cancer-Free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the AutoShip program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Do you want to maintain your mental clarity? With people living longer, we need more research into the ways to lower the risk of dementia. Studies are showing us that people who regularly read books, complete puzzles, or solve word games like the Sunday crossword puzzle maintain their mental abilities longer than people who don't. We also preserve memory by maintaining social activities, such as volunteering, attending religious services, or regularly talking with friends and neighbors. And diet plays a big role as well. It's important to eat a nutritious diet, free from heavy metals and chemical pollutants, and full of vitamins and the essential fatty acids which power the brain. These simple and important steps will help keep you mentally healthy for many years to come. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings.
We're back, everyone, discussing the health conditions that can be nutritionally supported with Boswellia. Now, Richard's got an interesting study to share with you, believe this or not, on gingivitis.
You know,
so, Richard, going from pain translating to gum health. I find that interesting.
Well, it is, but it goes to Boswellia's ability to calm inflammation. Folks, you know how periodontal disease, when the gums are inflamed, when they're inflamed with all the products of abnormal bacteria of the mouth, basically what it is, that blood goes right down into the heart, and now we know that gingivitis and an inflamed mouth is a major risk, a leading risk, a high risk for heart disease. And so brushing the teeth is very important, but sometimes that's not enough. Here's a study on teen girls with gingivitis because they weren't brushing their teeth enough. That's basically the setup for it. And they found that Boswellia was remarkably capable of reducing the gingivitis, calming down that inflammation. Of course, we need to brush and take care of our teeth. I'm not saying that. But many of you brush appropriately, but you still have the gingivitis. Add some Boswellia to that. CoQ10, probiotics, a little noni swish and swallow. You're going to make progress on this. It really works. Vitamin C is important for the gums, the integument, very important. So, 75 teen girls, a double-blind placebo-controlled trial, Boswellia helps with gingivitis. And it does it safely. See, that's the great thing. We have all kinds of things that can do amazing things to the human body, but the side effects make it prohibitive. And you're always weighing the advantage to the risk, advantage to the... You know, that's a non-issue with Boswellia. I like that. Here's one, double-blind, placebo-controlled, 40 patients with asthma. 300 milligram, that's one typical tablet, 3 times a day, provided 70% improvement in disease symptoms on average, 70% improvement. Reduced physical symptoms such as reduced dyspnea, meaning difficulty in breathe, just hard to breathe. That improved, 70%. Decrease in rhonchi, what's that? That's the noise that goes on in the chest. You know, the gurgling in the bottom of the lungs there. Rhonchi reduced 70%. Number of asthma attacks reduced. Sedimentation rate, the level of inflammation in the body is reduced. Eosinophil count, which is very important. Allergy-induced asthma, eosinophil count has a lot to do with the induction of asthma from allergy. So that eosinophil count will drop, along with improved forced expiratory volume in 1 second. How much can you blow out in 1 second? When you have asthma, it's more like you just can't get it out. So when you take Boswellia, forced expiratory volume of 1 second, you can get a lot of air out in 1 second. That means you can run. That means you can walk fast and not have shortness of breath and difficulty. This is your classic pulmonary function testing. The doctors do it all. Blow in this tube, we want to see how your asthma is doing. That forced expiratory volume in 1 second is your classic gold standard sign. When it's reduced, that's asthma, okay? That improves with Boswellia. Isn't that amazing? It also improves the peak expiratory flow rate, or the speed of expiration. So the whole volume of out and then in, out and in is better. See? So something for the doctors and nurses there. How about diabetes? Double-blind, placebo-controlled, type 2 diabetic, 60 patients, 300 milligram TID, same as the asthma dose, increased HDL levels in the diabetic, remarkably decreased total cholesterol, decreased LDL cholesterol, reduced the fructosamine. That is the high blood sugar damaging compound effect on tissues. You know, the glycation, the damaging of the tissues, the microvascular disease that diabetes is. It affects the microvasculature and hence everything in our body through that mechanism. It reduces those molecules that damage those tissues. It also improved liver enzyme ALT and AST. Takes a little pressure off the liver. You know, diabetic liver is in trouble, and Boswellia helps that. That's pretty impressive. Here's a double-blind placebo-controlled trial, 16 patients with chronic kidney disease. Now remember when Dr. Rich Snyder was here, nephrologist, he taught us about the importance of relieving the oxidative stress of the kidney in kidney disease. Reduce the free radicals in the kidney of kidney disease. Then you can open up the blood vessels and improve flow. But you got to reduce the inflammation and the free radical load in the kidney for this to work. And Boswellia does that. Lowers inflammation markers while it increases antioxidant level in the ailing kidney. So we can add Boswellia to our list of curcumin and grapeseed extract and fish oil and the things that we like to use in kidney disease to improve that kidney function. Here's one, topical application, half side of face. You know, you take a topical product, put it on one half of the face, the other half you don't do anything, and you compare the progress of the skin over time. 15 female volunteers, they used Boswellia, a topical agent. and they showed improvements in Dover's global score for photoaging. In other words, sun damage improved. Tactile roughness, the skin became smoother. Fine lines and wrinkles improved. Increased elasticity, okay? Reduction of sebum secretion and improvements of skin ultrasound testing. You know, as we age, the skin gets thin. Boswellia helps to thicken the skin. Isn't that amazing? I find that amazing. Next one, case study of 4 cluster headache patients. Now this is just 4 patients, so we have to take it all with a grain of salt. But in these poor souls who had cluster headaches for years, Boswellia reduced the intensity and frequency of the cluster headaches without dependency from narcotics, without the rebound inflammation and continued pain syndrome. It did all this without the side effects. Side effects of drug interactions and dosages. How do we use this Boswellia? Well, the only thing I could find in the literature, the only side effect is mild intestinal upset, not ulcer formation, nothing like that. You know, you feel a little different. Reduce your dose, stop it for a while, start it again, and maybe you'll find it doesn't affect you in the future. Allergy is possible. It's a plant product, but I could not find any incidents, no case reports of allergic reaction, but it's possible. Safety in children and pregnant and lactating mothers is undetermined, but don't you imagine a spice that has been used for over 3,000 years, a mother took this before she realized she was pregnant. If it caused problems in children, I think we'd know, but we don't have scientific evidence of that at this time, so I can't recommend it for children, pregnant mothers, or lactating mothers. You see the dilemma? And I'm not too interested in conducting experiments on little children just to find out, okay? There is a theoretical drug interaction, the P450 drug interaction, the cytochrome P450, and again, I searched the literature. I couldn't find one single case where they found it interacted with this, that, or then other drug. Boy, this is a clean supplement, Cindy. I'm not finding anything. Maybe there is. If there is, let us know, because we need to get that information out. But here you have a substance that's tested. It stood the test of time. 3,000, 4,000 years. It's in the Bible. It was a gift to the Christ child. I mean, that's pretty good credentials in my book. What do you think, Cindy? It's pretty impressive, isn't it?
Oh, it's so impressive.
How do you dose this? Start with 1 tablet 3 times a day. You can go up to 2 tablets 3 times a day, 4 tablets, 5 tablets if you need to, up to 20 or so a day. But you'll get relief, improvement 1, 2, 3 times a day. 1 or 2 tablets 3 times a day. So there you have it on Boswellia. Shall we go to our break? We'll return for your calls in just a moment. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828. That's 888-442-1828. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today.
May Savings Time is here again with our annual Cancer-Free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
We're back, everybody, ready to go to the phones now and take your call. Let's go to Alabama and welcome Virginia to the show. Hi, Virginia.
Hi,
Hello, Virginia. How are you today?
Dr. Becker.
Yes, ma'am.
I'm 76 years old.
Okay.
I have fibromyalgia causing severe multiple chemical sensitivities and allergies,
Uh-huh.
and I can't seem to take anything at all.
Really?
I have 50% blockages in both of my carotid arteries and inflammation in my top and the bottom of my esophagus. I've got lots of problems, so I don't know that I would have time to cover all of them, like my overactive bladder, spastic colon, and arthritis, cataracts, beginning of macular degeneration.
Yes, yes, and yet somehow you continue on.
And I've been like this for many, many years. I can't eat like anybody else.
Right, right.
I stay away from all the bad fats, all the high fructose corn syrup, everything, but I just can't seem to get better.
Are you in pain every day?
I do have some pain, but it's not severe. If I do try to take anything much, I do get pain, and I stay really nauseated and sick. I can't be around any kind of chemicals.
Okay.
Anything that has smells or things.
Do you react to vitamins and dietary supplements?
The only thing right now I've been able to take is I'm taking Bifidobacillus and Lactobalin from Nutricology, and I'm taking a probiotic from Dr. Whitaker. But I eat my own homemade yogurt every single day, and
that's wonderful.
I've been drinking 8 or 9 ounces of raw vegetable juices because of my esophagus. I can't tolerate the raw food, but I'm putting carrots, cucumbers, romaine lettuce, and stuff like that in it.
Virginia,
and I drink that every day, but I can't seem to get better.
Well, if your doctors are right in their diagnosis with the fibromyalgia and the chemical sensitivities and all these things, I choose, because I think it's more truthful, to look at a condition like yours and say there's one thing causing all these different symptoms. It's not really 12 different diseases that you've been labeled. That is really a game doctors play with insurance companies. The more diagnoses we have, it can justify a bigger office visit and more revenue for those who take care of the patient. And there's truth to that. It's a complex case, and it requires more time and effort. But in reality, it's really 1 or 2 things, and you have multiple symptoms that are often labeled as a disease. Okay? And it's been my experience that conditions like yours, it all comes down to vitamin D and magnesium. Okay? Vitamin D, magnesium, and other trace minerals. So here's what I think you should do. You should take vitamin D, at least 5,000 units a day. I would take 5,000 units of vitamin D3 every day. And if you've not been on vitamin D, I would take maybe 25,000 one time to kind of boost your level, and then take 4,000 or 5,000, depending on your size and obesity level, every day. And you have to think of vitamin D really as a hormone. We've labeled it a vitamin, but really we can make it for ourselves if we're in the sun. But we can't be in the sun to that extent because, it causes skin cancer, and we don't want that either. So we need to bump that vitamin D level up. Get it up. 4,000 or 5,000 units a day. Magnesium. Stop all refined salt, folks. Refined salt is as bad as refined sugar. Our bodies need multiple minerals to do the job. Okay, and when we refine the salt down to just sodium and chloride, We're missing out on so many important things like magnesium. So go to sea salt. It has trace minerals and iodine, and add the iodine to it. It really is what we need to do. So stop table refined salt and go to sea salt. Curcumin. This spice will calm inflammation. Take at least 2 a day. Boswellia, take 1 3 times a day. I'm going to send it to you. I want to send you magnesium chelate to take internally. Let's build that magnesium level up. Take 3 or 4 of those a day and rub magnesium oil, or excuse me, magnesium gel is really what it is, on your skin for more absorption. Take a little fish oil. I'm going to send you an ultra purified fish oil so it doesn't have the contaminants. Maybe you'll be able to tolerate that better. A little noni juice. Carotenoids for your eyes, and then I want to send you Active Adult Multiple Vitamin and Mineral Powder. This stuff is amazing. It's been designed for people who are really struggling, who need maximum nutrition. I want to send you some of our probiotic because I have tremendous confidence in our probiotic. It's well tolerated, it's multi-strain, and the most current research suggests that the multi-strains work the best. I want to send you Foundations for Healing. Take a complete holistic approach. Combine all the things at once. Start with tiny doses, build it up, and I think you'll find you'll be able to tolerate it so much better. You have the spark of health in your voice. We just got to find the ingredients to make it more complete for you. Let's go to break. We'll be back.
May Savings Time is here again with our annual Cancer-Free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online or call 888-442-1828 and place your order today. Ask about the auto ship program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Are you sleepy during the day? Many Americans are in a sleep crisis. They aren't getting a good night's sleep, so they suffer from daytime sleepiness. The reason may surprise you. You may be deficient in vitamin D. According to recent research, vitamin D deficiency leads to poorer sleep quality. If you aren't sleeping well at night, you are sleepy during the day. Vitamin D and the hormone melatonin are critical to our sleep cycles. Both are tied to sunlight. This is one of the many reasons why working night shift hours can be so hard on the body. So, if you're finding yourself nodding off during the day, before you turn to another cup of coffee, try some of the sunshine vitamin and see how vitamin D can help you get a good night's sleep. For Your Health at a Glance, I'm Dr. Richard Becker. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net.
Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back. Let's go to Arkansas now and welcome Gwen to the show. Hi, Gwen.
Hi, Dr. Becker. Hi, Cindy.
Hello, Gwen.
Hi. Well, I was calling because I just wanted to say thank you so much for all the information that you give, and because of that, I am in very good health. So
Wonderful.
I don't really have a major problem. The only thing I'm dealing with is I went to have my physical. When I went last year, I had the bone density test.
Correct.
And the doctor said I was in the early stages of osteopenia.
Okay.
So I was wondering if maybe the bone up might help some, or if
Sure.
there's something else you might be able to
Well,
tell
let me ask you, may I ask your age, dear?
Oh, I'm 70.
Okay. Remember how we define osteoporosis. It's 2.5 standard deviations lower bone mineral density than the average for age. So your test says that you're doing pretty good. You're comparing your bones to other women of your age, those who have osteoporosis, you're just barely touching osteopenia. So you're doing really quite well. And I understand you want to prevent osteoporosis. You know, it's not just a question of thin bones. It's a question of pain. Osteoporosis hurts and dramatically increase susceptibility to fractures that can put you in a hospital, lead to hip surgery, and even, well, you know what can happen with hip fractures. This is a common scenario. It can be life-threatening hip fractures. So you're wise to do this. You know, up to 2 grams of calcium a day is beneficial, okay? So don't push too high. There is some evidence that when we're taking extremely large amounts of calcium, it can tend to calcify our arteries, but that takes a lot. It really isn't as related to dietary calcium as much as people think. The forgotten mineral, magnesium, is actually more important. It's magnesium in your diets and supplements that sets your bone mineral density. For every 100 milligrams of magnesium you add to your diet, your bone mineral density increases by 1%. So if we put you on 500 milligrams of magnesium chelate every day, at the end of that year, your bone mineral density will increase between 3 and 5%, which is better than Fosamax without the side effects. You can lie down after you take magnesium. You can't do that after Fosamax, you see? So other things that are important, vitamin B12. Okay, we need B12 to lay down bone. Take a little B12 a couple, 3 times a week. Take it every day if you like. If it helps your energy, you can take more. There's no dose-related side effects to B12. Also, the omega-3s need to be present in order to make proper bone. Exercise, don't forget, take your walks, very important. I think it's important to stop all regular refined salt and go to the sea salt again, because it gives you those trace minerals. You know, we need boron, for example, silicone to make bone and to maintain our bone. So that would be in your sea salt. Okay. Also, you can take coral calcium. That is a more diverse source of minerals. All of that's available to us now. I mean, it's easy to find. We have it too. Also, a good multiple vitamin and mineral for all those essential nutrients, even the micro and the macro ones, all combined in together. A little vitamin D. Osteoporosis is not a disease of vitamin D deficiency, but your bone mineral density will decline faster if you're low in D. So take your vitamin D. Typical dose, 3,000 to 8,000 international units a day, depending on your size and obesity level. You know, folks, 1 international unit of vitamin D is 0.000001 grams. It's a tiny amount, so these are not huge doses. It's safe to do. Also, Gwen, I think you're doing a good thing here. You're in good shape. I want to send you Foundations for Healing. There's an entire chapter, okay? And the Bone Up will be coming with it to get you that way. Bone Solid, we have all kinds of new products now that we can all check out. Well, Boswellia, a great addition to your plan if you're living in pain. Don't accept the pain, folks. If we can decrease it just a little, it makes a difference. See you next time. Bye-bye.
Thank you. Bye-bye.
Is your closet cramped and cluttered? Well, now there's Space Triangles, the clever new hanging device that fits over any hanger to save you closet space in seconds. And now may be your last chance to get them for a low price. Now you can vertically hang multiple items, guaranteeing that you'll have up to 70% more space in your closet. Your closet can go from messy to marvelous in no time with ease. The ingenious slip-over design secures the hangers vertically. It snugly fits all types of hangers to save you space. Order now to get an 18-piece set of Space Triangles for just $9.99. But wait, due to rising costs and supply chain shortages, this may be your last chance to get Space Triangles at this low price. There is a strict limit of 1 closet pack per order while supplies last. Once they're gone forever. Order now.
Call 1-800-592-7531. Call or visit spacetriangles.com. So call 1-800-592-7531 now.
Golfers, who out there wants to hit their longest drives ever? Jack Ham, world's longest driver and golf leading product innovator, has designed the new future of drivers. Check out Jack's new Hammer Turbo Air, the only driver powered by air. It's simple science. Wind tunnel tests show a 37% increase in speed and distance. The Hammer Turbo Air, the aha moment. It's all speed. The Hammer Turbo Driver has 6 air speed slots, base age, see-through shape, a power core with wing-shape aerodynamics, the biggest sweet spot ever, and an exhaust manifold releasing the air drag. This is real golf technology. Want more speed? There's even a fast sword-shaped shaft cutting